We can't positive think our way out of that. We have to be neutral, even if it's something with body, right? Instead of, oh, I love my body. I'm so happy in my body. Maybe be like, I'm thankful for my body is giving me today, or I'm thankful for what I can do in my body in this moment, right? It doesn't have to be something that feels unrealistic or that doesn't feel attainable, because when we're trying to convince ourselves of something that we don't believe at all, we don't buy into it, it's not going to be helpful.
Welcome back to the PCOS Holistic Coach podcast with me, Dr. Ami Patel, pharmacist, fellow sister, and coach. This podcast is an easy to listen to resource for your busy on-the-go life. You will learn how you can live a healthier and happier life with PCOS from real conversations about managing PCOS and the symptoms with amazing guest speakers. Hi, Divya. Thank you so much for joining us today. I'm really excited. Thank you for being here and sharing your expertise and experience with us.
Of course. Thank you for having me. And thank you for honoring Mental Health Awareness Month. I'm so glad that we're having this conversation, and I know it's going to benefit so many people. So I'm looking forward to it.
Yes, amazing. So just a little bit about Divya. Divya Robin is a licensed psychotherapist, wellness educator, content creator, and media contributor in New York City. She specializes in working with adolescents and adults who are feeling stuck, dealing with anxiety, depression, self-esteem struggles, relationship issues, and life transitions, which we're going to cover today in the talk. So I'm really excited about that. She's an active mental health advocate and uses her knowledge and passion to destigmatize psychology and mental health in the media. She's been featured in ABC, Psych Central, Well Plus Good, Good Morning America, HuffPost, and The Zoe Report. Additionally, she uses her social media platforms to cultivate a growing community that encourages people to connect deeper with themselves, their emotions, and their relationships, which is amazing. And I love all your posts. It definitely gets me to think a little bit deeper, like you said.
Thank you.
So why did you choose to become a therapist and specialize in anxiety, depression, and self-esteem?
Okay. Yeah, so I wanted to be a therapist since middle school, since I was 12 in 6th grade. And this was when therapists were not seen, I guess, in a preventative way. It was more reactive and not proactive. So we would imagine that more people who are more symptomatic would be seeing a therapist. And so the reason that I ended up, it's actually really funny that I ended up choosing therapists is because my whole childhood I had been given the idea, internalized the idea that I had to be a medical doctor, just
of course,
South Asian kind of thing.
Yes.
And when I had to write this paper, it's so funny. I was talking about it and my best friend was like, you hate blood. I have this thing I hate getting my blood drawn. I hate blood. It's just to this day. And she's like, how are you going to be a doctor? And I was like, you know what? I don't want to be a doctor. So then I started talking around to people well, I don't know what I want to be, blah, blah, blah. And people had brought up a therapist, you love to talk to people. And of course that was not, it was a very high level way of what a therapist is. So I was like, okay, cool, I want to be a therapist. And the more I got to know what a therapist was, it really was enlightening to me. And so then I was like, I'm going to be a therapist. And the older I got, I started to learn more about psychology and immerse myself in clinical experience. And I saw, especially in the South Asian community, such a big gap in mental health providers or therapists that even look like a South Asian. I had thought for so long that therapy is for essentially white people because I didn't know any therapy. So, that's where it started. And then in terms of anxiety and stress and depression, relationships, I think it's just those are topics that so many of us go through, but we just don't know how to normalize it enough. And again, especially the South Asian community, I think a lot around pressure and perfectionism and overachieving and, being able to learn for us what is working and what's not in a way that doesn't have shame attached to it. And so I really wanted to bring that into the space for South Asians and also first generation immigrants. And so that has been kind of my driving factor to it.
No, that is so amazing. And I totally agree with you. Seeing someone that looks like you, it just makes you more comfortable, talking to that person. There's that general lived experience that you have, that you understand, that someone doesn't have to explain to somebody that's
Exactly.
like not South Asian. So definitely. Well, thank you for everything that you do to help the South Asian community and
Yeah.
anyone that is in need of mental health services.
Yeah. I'm so
So
glad to do it.
yes, and you're so passionate about it, which is amazing. So generally speaking, how does mental health look like for women, and what are proper ways for us to care for our mental health?
Yeah. So women face different mental health struggles than men. I always say that the field of psychology and what mental health looks like and the theory behind it is so tailored to like white men and not as much toward women. So we have to acknowledge
Yes.
so much that comes into mood, right? Mood does not happen just like a woman feels a certain way, or someone feels a certain way, and it's like, oh, they're anxious or they're depressed, right? We women face hormonal changes that also impacts their mood a lot, and the fluctuations through their week, through their life, through menstrual cycles, pregnancy, menopause,
Mhm.
postpartum. There's so much that goes into there. And then also in terms of societal expectations, that's another really big one that women deal with in terms
Yeah.
of gender roles, societal expectations. And especially I would say in the last generation, it's really been kind of women immersing themselves in the workforce. And so the pressure that
Mhm.
comes from that, and especially if they choose to become a mother, they have the desire for that, and they are a mom, how to balance some of that. And I would also say another facet of women and mental health is around body image and eating
Mhm.
disorders. So
Mhm.
definitely
Mhm.
women face
Mhm.
so many societal pressures regarding their appearance, body, low self-esteem around that. And so that's another area that I would say are some unique struggles that women go through that also are not typically discussed in like old days fields of psychology. And so those
Yes.
are things that we have to start having conversations about if we want to have inclusive mental health care.
Definitely. And I think that's like even just medical care in general too. There's so much like research behind men's conditions and not as much behind women's conditions. And that also brings me, like what you're saying, brings me to the next question. Like women that have PCOS, they struggle a lot with body image because some of the symptoms can be things like hair loss, acne, difficulty losing weight.
Yeah.
And then that leads to a lot of like negative thoughts and negative beliefs about oneself, right? Like even me personally, like sometimes when I was at my worst with my PCOS, I would think like, oh, I'm not beautiful or I'm not feminine. Like, and yeah, things like that. And then even the complications, sometimes people can like struggle with getting pregnant, so then they have that belief like, okay, I'm never going to get pregnant. So what are your tips in managing those types of thoughts and beliefs?
Yeah. Well, I would say to start neutral. That's something that I really firmly believe, especially when we're going through something that is out of our control, like a medical condition. We can't positive think our way out of that. We have to be neutral, even if it's something with body, right? Instead of, oh, I
Hmm.
love my body. I'm so happy in my body. Maybe be like, I'm thankful for what my body is giving me today, or I'm thankful for
Mm.
what I can do in my body in this moment, right? It doesn't have to be something that feels unrealistic or that doesn't feel attainable, because when we're trying to convince ourselves of something that we don't believe at all, we don't buy into it, it's not going to be helpful. So when trying to shift those beliefs, I would definitely start with just recognizing when certain triggers come up and how can you just make it neutral, and also your own self-compassion and giving yourself the time and space to feel your feelings, whether that be anger, right, for a circumstance or
Mhm.
situation. You're not ungrateful for your body or ungrateful for circumstances for being angry or being frustrated. Like you can hold both of that. So leaving space for that, because I think there can also be a lot of guilt with I'm. Yeah. So the last part had been how to be able to make room for the emotions that come up. We can also like
Mm.
so many times we say I shouldn't feel XYZ. So how can you have room for that? And if it's anger, if it's frustration.
So basically, I think to summarize, you were saying like basically respect your emotions and don't like try to just convince yourself like be positive and
Yes.
just like okay, yes, I feel like,
Yeah.
beautiful if you don't, but respect how you actually feel and try to turn it instead of negative at least to a neutral point.
Exactly.
Then maybe like focusing on what you can be grateful for your body if it's separate like. And that's a good point because like last fall I broke my ankle and I was so like I couldn't work out, so I just felt like a blob and I was like, oh my God, I'm gonna gain weight, like I can't work out. But then like I mean it took me a long time to get there, but I got to the point where I was like, you know what, like I'm grateful that my body can actually heal my ankle without needing surgery or a cast.
Yeah.
So I like that you brought that up. Yeah, that's a good point. And then I think you mentioned like triggers. So like a lot of times people with PCOS can face anxiety in different situations, like looking in the mirror and just like with hair loss, like taking a shower. That was something I was anxious about, or even like social situations because people point out things unnecessarily or make comments or say things like, oh, when are you going to have kids? You know, and if somebody is struggling with infertility, like what are your tips for addressing anxiety?
Yeah. Yeah. And the hard thing is, unfortunately, we can't control what people say. All we can do is set boundaries or have conversational boundaries, whether that be a conversational boundary around, I don't feel comfortable talking about this, or I'd respect if you don't bring this up, or even leaving. Like that's also setting a boundary. You're not rude if you leave a situation. It's setting a boundary. If it is something that is not, it's harming your mental health. And the other one, when you were talking about your own triggers, to just have self-awareness around it and noticing when the triggers and anxiety arises and giving yourself some extra self-care with that, creating space for it. I think when we push our triggers aside or what emotions come up from a trigger, we just make the whole experience even more intense versus if we really just attend to when each trigger comes up and give yourself self-compassion. And also to just remember, and I know this is so much easier said than done, that your worth isn't determined on your physical appearance. And I know, especially in the society that we live in, it's such like a lookist society that puts certain beauty standards on a pedestal that it can be really hard to internalize that message. But just starting to remind yourself that continuously, and you might not believe it. The goal is not for you to just like 100% believe it immediately, but then to keep like retraining your thoughts that, okay, my worth is not solely dependent on my parents. My worth is not solely dependent on my parents. Like continually saying it until it starts to feel more true to you.
Hey there, I just wanted to take a moment to tell you about a free resource I have. PCOS is a lifelong condition and it cannot be managed with just a fad diet or a new workout trend. PCOS requires making small, impactful changes in all areas of your life and on a regular basis to see results and make them last. To learn how you can have freedom from PCOS symptoms, watch the replay of my masterclass, 5 Steps to a Sustainable Lifestyle, for free with the link in the description below. Now, back to the episode.
You know, I think like I really like how you keep mentioning like focusing, like respecting how you feel and acknowledging that, because I think we are taught like just be strong or just push through and not ever really taking the time to just say like, you know, actually I don't feel good and I don't like this and it's okay because that's how it is right now, and then like dealing with it too. But yeah, and I think that's a good point because the more you like push or hide those feelings, then they kind of just come up in a different way. And I guess it can turn into like depression too.
Absolutely. And the more that we just push our feelings down, it just gets more intense, right? It will explode at some point. So it's honestly like having acceptance toward a feeling actually has it come and go and pass through more efficiently than if we're trying to push it away.
Yeah, definitely. And just like allowing yourself to do that, which I'm not, I'm like processing that because, you know, it's such a good point. Like, yeah, like, no, you know, like all the society stuff, like you've been saying, like, you know, no one, it's just like put on a happy face and like, you know, pretend you're like happy, pretend you feel good. If you're like out, you know, at like events or like family events, you know, it's like put on a face and just like represent the family and be happy.
It's so much pressure.
Yes. So what do you suggest to someone who like tries these things and they're still not feeling better? Like, what are your tips for seeking professional help and finding the right therapist?
Yeah. I mean, the right therapist and fit is the biggest successor or the biggest tool for successful treatment, to be able to have that relationship where you feel you feel safe, you feel like you can be understood by your therapist, you feel seen. And just like friends or someone you date, it might take some time. You're not going to be friends with each person. You're not going to vibe with each person that you date. So it's okay to like really prioritize fit and to put that at the forefront, because when you have the fit, then that's when change can really happen, and there's that safe space to be able to start to create that change. So definitely, I always start off with that, because people, first of all, finding a therapist is daunting as it is, but having to kind of that, if it's the first therapist you meet, that's amazing, and I'm so happy for the person who that is. And it does happen. I see it happen for a lot of people, but then for some it takes some time. So for them to not feel scared by that, and when looking for a therapist, be like, it could be this therapist, it might not, and to have an open mind about it, and then to look for a therapist that specializes in what you're looking for. Like, what are some of the main presenting issues that you're going to therapy for, and can you find someone who resonates with that? Also, a lot of therapists offer free consultations, so you can even set up free consultations with therapists and see which one that you feel the most connection with and start moving forward with them. But yeah, the biggest thing is to feel safe in that environment, that you can trust the person.
Yeah, that's a good point. I think people make this mistake, like even with doctors, like they just find one doctor or a therapist and then they feel like, oh, well, I'm committed now. Like they already know my history, or like they already like know about my problem. But even at that point, you still say like, if you're just not feeling it after like a couple sessions, it's okay to try to find someone else.
Yeah, and so many times people are so worried about the therapist feelings about this.
Yeah, that too.
It's your space, right? The therapist is okay. They're trained in it. It's for you. So if you don't feel the fit and you don't feel like you're getting something out of it, that's only hurting you, not the therapist.
That's true. I think it also goes back to like, prioritizing your own health first, and only you can be your own advocate for your health, mental health, physical health, and no one is going to know what's working for you as much as yourself.
Yeah, 100%.
So some challenges that come with PCOS can also affect like relationships, like mental health, or struggling with infertility. So what are your tips for like maintaining healthy relationships with significant others or friends and family?
Yeah. I'd say that definitely the first one is the open and honest communication with them, and sharing with them your feelings, maybe the way PCOS impacts your life and how that impacts you on a day-to-day. Like, how do you feel like you view yourself differently? What comes up for you in society because of it? Because your partner or family members, if they're not going through it and they don't have that experience, they're not gonna know, and so they won't know how to best support you unless you're open and honest with your experience. So being able to talk about that with those who feel safe and comfortable. So definitely having open and honest communication, remembering that you are not a burden, that those who love and care about you are there for you in those moments to talk about. Also educating, because to help the person that you love, right, you have to share what it is and how to educate them on it. Maybe that can be like sharing resources with them, inviting them to an appointment, but just like overall increasing their knowledge so that they can better understand the effects of it, so then they can overall provide better support. And then overall, if it's like with a partner and it's really kind of getting in the way of your relationship, family counseling, couples counseling can also help navigate those kind of struggles as well.
Yeah, that's a good idea. And it's like seeking those professionals that have experience with this can definitely support the couple, and they're a neutral party, so it's not like, they're taking sides. And then one last question I had is, like we were mentioning earlier, in South Asian communities and society, like mental health is so taboo. If somebody wants to seek help for their mental health specifically, or just communicate about it with their friends and family, especially like maybe parents that are of older generation, what tips do you have for that?
Yeah, that's a very good question. And starting off with saying, we can educate people, but we can't control, again, how people respond. So like starting off with finding your community of people who care and support you. I think that this community you've built is amazing because a lot of people don't have that, and maybe this is their place, right? And that's okay if it's not with their family or it's not with their parents or their siblings, because we can't control what they do, but we do still deserve to have that safe space and for us to feel like we have a place to process in a healthy and safe way what we're going through. So again, we can't convince other people. What we can do is educate people to maybe influence how they respond to us, but being able to remember that what a safe space and community looks like can go beyond family. And it's okay also if you talk to your family about it in ways that you have expectations that they can be there. Maybe that is the stuff that's more like kind of direct, like coming to a doctor's appointment, right? Versus asking for emotional care, because maybe that's not their strong suit. Everyone's strong suit is different. So understanding what are different people's strong suits, and then how can you use that to serve your needs? Like you're not expecting something of someone that they're unable to give you. And then the vice versa. Like, you know, we want to be able to understand what people are capable of in relationships too.
Wow, that's so good. So basically, like, know realistically what other people can give you and go to them for the things they can support you in, and maybe find a community elsewhere. It could be like online nowadays, to get help. Yeah. No, that's really, really helpful. Thank you.
Of course.
Is there anything you wanted to add? And then if anyone from the audience wants to ask a question, they can come on or drop it in the chat.
Yeah, no, I love all these questions that we asked. I know that we collaborated and chatted about it a little before, but again, I'm really glad that you're having this conversation, especially when we talk about mental health, because a lot of time we focus on physical health, and especially with PCOS, right? There's so much around the physical symptoms, but it's also mentally and emotionally taxing too. So it's really good to have this conversation.
Yeah, definitely. And you shared such great points that I'm just like, yeah, I'm definitely gonna like listen back to this whole conversation again and just, yeah, seriously, it's so good. Like, I'm so glad that we collaborated on this. So thank you so much.
Of course.
Okay, I don't think there is any other questions. So thank you.
Covered it in a amazing way.
Yes. Thank you. Despite all the technical difficulties, but it all worked out.
Oh my gosh,
yeah, it's life.
Yeah, totally. All right. Well, thank you so much for having me, and I appreciate it. If anybody has any questions after in your community, you can feel free to email me.
Yes. Also, where can we connect with you on social media and resources that you provide?
Amazing. Thank you so much. I almost forgot. So you can find me on divyarobin.com, and then also at Mind Matters with Div on Instagram. If you go to the link in my bio, you'll see everything that I offer in terms of if you want to work with me, free resources that I have, courses that I have. And so everything is over in that link.
Amazing. Thank you so much.
Amazing. Thank you so much.
If you enjoyed this episode, please leave a review on the podcast so it can reach other listeners that need support with their PCOS. If you're watching on YouTube, please like, comment, and subscribe. I would love to connect with you. Send me a DM on Instagram or TikTok at pcos.holistic.coach. Until next time, thank you so much for tuning in.